So today our topic is services, and this is kind of a hard topic because there are so many different entities doing so many different things that it can be hard to summarize this simply in a way that helps everybody. So this is going to be pretty high level. If you have specific questions about services, you can drop those in the chat, the comment box, and I'll try to answer them as specifically as I can for your entity. And I'm sorry about my lighting today is not great. The services are basically the core services and contracted supplementary services that your agency offers to clients. How you present those, like we talked about yesterday in your financial policies, making sure that you reflect what you're charging for those services and that your patients are notified upfront what their charges will be, and how you'll be billing them for those services. So, each entity or different type of agency is going to have different services. So, for hospice, you're going to have nursing services, you're going to have counseling services, and you're going to have contracted services. Like most often, your physicians are going to be a contract service. And most often for hospice, you'll have a contract, it's required. So you'll have a contract with a therapy agency, where you have a partnership where if a patient were to need some type of therapy for speech or physical therapy or occupational therapy, that you have that contract available to offer to your patients. So those are the kind of services they're going to want to see for hospice. There's core and non-core services. You can look what those are up for your specific entity. Really, that's more specific to home health and hospice. For private duty home care, you're probably going to have services that are based on, the needs of your patient. You're going to have that assessment and that plan of care written around those services. And for ACHC and CHAP accreditation, that is required that you have a clear delineation of services, that you have an initial assessment based on the needs of the patient, and that is written in a plan of care. And that physician orders exist if those services require a physician's order. So like physical therapy would. So those are some of the requirements for different kinds of services. But really the one that's a little more complex would be home health. So when I'm looking at the services, and I'm referencing my notes here so that I don't misspeak, when I'm looking at the services for the essential components for home health, the surveyor is going to want to see that the home health agency provides part-time or intermittent skilled services and at least one other therapeutic service. So a therapeutic service would be, like we talked about, would be physical therapy, speech therapy, pathology or occupational therapy, medical social services, or home health aid services available on a visiting basis in the patient's place of residence, such as their home. So for ACHC, a home health agency must provide at least one of the qualifying services in its entirety through agency employees, as evidenced by proof of W-2. So it's saying that you need to provide one of those core services through your full-time employees, can't be contracted out. So you can provide the second qualifying service and additional services under arrangements with contract or other organizations. Contracted staffing can be used as a supplement to staffing for direct service, but not used in lieu of agency staff. So the use of contracted staff for direct care has to be on a temporary basis to provide coverage for unexpected shortages. And if an agency staff member is employed by more than one provider, each provider must maintain separate records. So you still have to have an employee record and W-2 for all your employees, even if they're employed by another agency. If they are your employee, you need to have a record for them. So those are kind of the overview of the services for each agency and entity. And so really what the surveyor is going to look for is that you provide those core services and that you provide those contract services and that you have records of those. So hopefully that's not too confusing and that was helpful. So next week, we're going to start really getting into less broad topics and less organization level topics and really start getting into the compliance and accreditation process. So I'm really excited for that. We'll talk about a bunch of new topics next week. Thank you guys that joined me this week. It was great. Feel free to leave any comments in the box for me, and I'll try and answer any questions you might have. Aloha Friday, and have a great weekend.